These pigeons here, ostensibly harmless creatures, symbols of love, are now leading to war in cities and urban centers between city dwellers who love to feed these pigeons and healthcare experts who say that their droppings, pigeon poop, is a serious health concern, causing problems among city dwellers, and that this sort of feeding must stop. It causes hypersensitivity pneumonitis, also known as bird fancier's lung. This is an immune-mediated lung condition triggered by repeated inhalation of fine dust particles from dried droppings or feathers. But pigeon droppings also cause Cryptococcal Meningitis, which is a fungal infection that spreads from the lungs to the brain, with symptoms such as confusion or changes in behavior, and Psittacosis, which is a bacterial infection with pneumonia-like condition. But do people even know about these problems? Birds and animals usually capable होते हैं अपने लिए खाना ढूंढने के लिए. तो ये खाना जब आप देते हैं, आपको पता है कि एक्सेसिव खाना होता है, तो एक्सेसिव पिजन के ड्रॉपिंग्स भी होते हैं, उनके पूप होती है, जो जैसा उनका एक्सक्रीटा होता है, वो ड्राई हो जाता है. उससे जो डस्ट बनता है वो हमारे लंग्स के लिए बहुत हार्मफुल है. एक बहुत बड़ा पब्लिक कंसर्न है, पब्लिक हेल्थ कंसर्न है. आपको इस बारे में क्या पता है?
नॉलेज नहीं है मैम,
इस बारे में आपको
इसकी नॉलेज नहीं है. तो ये तो गवर्नमेंट बंद करे ना मैम. अब ये तो 20 सड़क पे तो बैठे हैं, ओपनली बैठे हैं. अथॉरिटी चाहे नोडा अथॉरिटी के अंडर है सारा ही. अथॉरिटी चाहे बंद कराए इनको, जब बैठेंगे ना लोग डालेंगे.
जैसे आप हैं, आपने मुझसे कहा आपको पता नहीं है. आपको लगता है कि ऐसे कई सारे ऐसे लोग हैं जिनको पता नहीं है?
पता नहीं है, बहुत बहुत सारे लोग हैं. 10-20% ही ऐसे होंगे इनको पता होगा. तो जिनको अथॉरिटी को पता है, गवर्नमेंट इसके खिलाफ अवेयरनेस क्रिएट करे, बंद कर दे बिठाना इनको. अब ये बैठेंगे नहीं लोग तो फिर लोग डालेंगे नहीं.
तो आप कह रहे हो कि अगर अवेयरनेस क्रिएट हो तो फिर आप भी इसको ना करेंगे?
हेल्थ इशू है, सीरियस हेल्थ इशू है, तो फिर उसके लिए हम भी एक सुटेबल एक्शन लेंगे.
Do you think that pigeon feeding should be restricted or banned in a way so that an awareness campaign is also generated in a city like Delhi where pollution is already a big problem?
I do agree that it should be in a controlled manner.
While in Delhi, this really hasn't ruffled too many feathers, at least for the time being, but in the state of Maharashtra, this has become a huge bone of contention. Public clashes, the matter even reaching the court. Mumbai's iconic pigeon feeding stations, known as Kabutarkhana, have sparked a heated controversy following a Bombay High Court order on the 31st of July 2025, banning public pigeon feeding due to health hazards like respiratory illnesses from droppings and heritage site damage. The Jain community, for whom feeding pigeons is a sacred act of compassion, protested the closure, particularly at the historic Dadar Kabutarkhana. Their defiance, including removing BMC-installed barricades, led to clashes with the police. Dr. Harish Shafle from Mumbai's Glen Eagles Hospital is now joining us. Thank you so much for your time. This is a problem which has become almost centric to Mumbai city. Yes, in Delhi and other cities as well, but right now, a lot of conversation around pigeons in Mumbai. Talk to us about what you are seeing in your patients presenting with problems that indicate that they've come into proximity with pigeons and pigeon droppings, and that possibly could be leading to problems, Dr. Harish?
Yeah, so yeah, as rightly said, the problem was there and it is getting identified more and more. That is what I would like to tell. So the patients who suffer from this exposure to pigeon droppings and pigeon feathers, they usually have a history ongoing basically since maybe 6 months or more. They keep on getting this dry cough, and initially there is just cough, and then the cough is followed by breathing difficulty.
Right.
Usually what happens initially, they don't they adhere to a specialist to seek advice regarding it. They think that it's a viral infection and causing cough because the season is ongoing of dry cough, runny nose and fever in everywhere. And so I think that is why this thing doesn't get detected early. So predominantly dry cough, breathing difficulty and other symptoms associated is what I would like to tell.
Who's vulnerable in that sense? And I'd like to ask you, because I don't think everybody who's come in contact with pigeon droppings would be vulnerable, isn't it?
Yeah, so most vulnerable basically usually will be people who directly handle the pigeons, or they try to clean the pigeon waste basically, which keeps on getting accumulated to their window panes and their important areas of their house. They try to they say brush or dust that area basically. Then there is an exposure of these white droppings, and once you try to show away the pigeons, they fly, and they, in the bargain they create a dusty environment of the pigeons also. So these are the persons who are at most risk, and also people usually elderly or people who are already on other medications who have other comorbidities. I would say if you get in touch with these pigeons every now and then it becomes you become more vulnerable.
Well, these pigeons play important role as environmental cleaners. These are natural scavengers. They pick up, clean up food scrap, even organic waste, and that's how they feed themselves. By feeding them, we're disrupting this natural cycle. It's leading to over-dependency. It can lead to overpopulation of pigeons, as we have seen clearly, and then related health problems, health risks. What experts advise is that this is their natural ecosystem. It would be best not to feed them and not disturb this natural system.
You are not supposed to directly touch the pigeon droppings, which is white in color basically, or pigeon feathers which come near you. So don't touch with your bare hand. That is the first thing I would like to tell. If you really want to clean that area for the droppings, whatever has been created, then use a gloves basically, or you might use a mask, an N95 mask with properly fitting nose clip is what I would say. But if you want to really get away with don't want to get exposed to it, then definitely don't do these things, or put nets around your home where there are spike nets also available where the pigeons will not come and sit in that area, or there are nets available where even if the pigeon comes and they fly away, the feather droppings will not enter your room. So all these precautions are very important, particularly not to touch the white of the pigeons, and wearing mask whenever you are handling these pigeons.
Well, for most people, pigeons may not be causing problems. But for those people who are having problems like chronic cough, or for example, some sort of respiratory distress, you are in close proximity with pigeons, it would actually be a good idea to get in touch with your doctor and figure out if you're suffering from any problems that are being caused by pigeons.
If you like the video, do like, comment, share and subscribe.